Senator from Connecticut.
Thank you, Madam President. Madam President, I want to tell a story of a 57-year-old man from Boyerstown, Pennsylvania. It's a pretty interesting story. His name is Dean Engstadt. And Dean is a self-employed, self-sufficient logger. And he's the kind of guy, like a lot of Americans out there, that had sort of grown up to believe that he could do everything for himself, that he didn't need a lot of help from people around him in order to make a living, in order to provide for his family, in order to keep himself healthy. Now, he's been uninsured since 2009, and he had some particular thoughts about the Affordable Care Act. He knew he didn't want anything to do with Obamacare. Now, in 2011, Dean had a pacemaker and a defibrillator implanted to help his ailing heart pump more efficiently. And not long after he got these two implants, this 6-foot, 285-pound guy was back out in the woods. But last summer, his health worsened again, and it was taking him about 10 minutes just to catch his breath after he felled a tree. And by the fall, he was winded after just traveling the 50 feet between his house and his truck. Dean said, "I knew I was getting really sick. I figured the doctors were going to have to operate. So I tried to work as long as I could to save money for the surgery, but it got to the point where I couldn't work." And so he called his friend Bob, who's a 55-year-old retired firefighter and nurse, and talked about the fact that he was having trouble. And Bob said, "Well, why don't you check out the Affordable Care Act?" But every time he made that suggestion, Dean refused. Dean said, "We argued about it for months. I didn't trust Obamacare. One of the big reasons is it just sounded too good to be true." Well, January came and Dean's health just continued to get worse. His doctor made it clear that he urgently needed valve replacement surgery, and he was facing a choice. He either had to find a way to get health care or he was going to die. That was his choice. Find a way to pay for health care or perish. Now, luckily, his friend Bob finally convinced Dean to come over and at least take a look at the affordable care plans that were available to Dean. So he came over to his house, and in less than an hour, the two of them had finished the application. And a day later, Dean had signed up for the Highmark Blue Cross Silver PPO plan, and he paid his first monthly premium of $26.11. Dean said, "All of a sudden, I'm getting notification from Highmark. I got my card. It was actually all legitimate. I could have done backflips if I were in better shape." His plan kicked in on March 1st, just in time to get the surgery that he couldn't have afforded otherwise, that he couldn't have put off any longer. And on March 31st, after his surgery, he said, "I probably would have ended up falling over dead without that surgery. Not only did it save my life, it's going to give me a better quality of life." And now he says this. He says, "For me, the Affordable Care Act isn't about politics." Dean says, "I'm trying to help other people who are like me, stubborn and bullheaded, who refuse to even look. From my own experience, the ACA is everything it's supposed to be, and in fact, better than it's made out to be." Dean's story is one of 8 million stories that can be told all across the country. 8 million people have enrolled in private health care plans under the Affordable Care Act. Why? Because there's a simple premise embedded at the foundation of the Affordable Care Act, and that is that you shouldn't get sick. In Dean's case, you shouldn't face death simply because you don't have the money to afford surgery. Dean was working. Dean was a logger, salt-of-the-earth kind of guy who was playing by the rules, obeying the law, had a job, but he just didn't have the money to afford that expensive surgery. He gets to live, he gets access to health care because of the Affordable Care Act, not because of a government handout, but because of our collective decision to just give Dean a discount on private health care, one of 8 million people all across the country. Now, that's just the number of people that have been insured on these private exchanges. 3 million young people under the age of 26 have been able to stay on their parents' plan because the Affordable Care Act allows for that to occur. New numbers this week suggest that more than 4.8 million people have enrolled in Medicaid and CHIP plans between October of 2013 and March of 2014. Another approximately 1 million individuals gained coverage through an early expansion of Medicaid that happened in states before January 1st, 2014. Put that all together, 8 million people on exchanges, 3 million young people covered through their parents' plan, 5.8 million people on Medicaid. We've got about 16, 17 million people in this country who have health care, who didn't have it before. In my state, the numbers are even more remarkable. We had a goal of signing up about 100,000 people, and we went out there and did everything we could to get the word out about the Affordable Care Act. And we didn't sign up 100,000 people, we signed up 200,000 people. To be exact, we signed up 208,301 people in Connecticut. In the last day alone, on March 31st, 5,900 people signed up in Connecticut. Connecticut's a small state. We only have a handful of million people who live in our entire state, and we increased those who have insurance by 200,000 in a state of only a few million. And that probably is why, that fact that in states like Connecticut, 200,000 people now have insurance, 15 million plus across the country have insurance, that the polling is starting to fundamentally change. A Washington Post poll from a few weeks ago showed that for the first time, a majority of Americans support the Affordable Care Act. A new poll in battleground congressional districts shows that 52% of respondents want to implement and fix the Affordable Care Act, which is about 10% more than those people who want to repeal and replace the bill. That 52% number is increased beyond what the poll showed last December. That 42% number of those who want to repeal and replace is much less than the number from last December. People are starting to figure out that all of the Republican spin and rhetoric about the Affordable Care Act is just that, spin and rhetoric. And the reality is that 15 million people have access to health care. And the stories like Dean's can be multiplied all over the country, in every corner of this great nation. But here's the even better news, is that we are not only enrolling more people, but we're saving money. We're enrolling more people and we're saving money. Medicare spending growth is down. Medicare per capita spending is growing at historically low rates. In April, for the 5th straight year, CBO reduced its projections for Medicare spending over the next 10 years. This time, they reduced it down by another $106 billion. This is what we always said was the problem with the American healthcare system. We always said that we don't insure enough people. We still leave 30 million people without access to healthcare, and we spend twice as much money as our other competitor first world nations. Less people insured, much greater cost. We all came down to the floor of the Senate and the House and said the Affordable Care Act will tackle both problems. And now, a few months into the full implementation of the law, that's exactly what's happening. And it's actually costing less than we thought. The projections are that the Affordable Care Act is going to reduce the deficit by $1.7 trillion over the next 2 decades. Let me say that again. The Affordable Care Act will reduce the deficit by $1.7 trillion, meaning if you repeal the Affordable Care Act, as so many still want to do, as the House has tried to vote on 50 different times, you would increase the deficit by $1.7 trillion. And the overall cost of the program is 15% less than what the initial projections were. And insurers are starting to weigh in as well. The second biggest U.S. health insurer, WellPoint, increased its profit forecast after the ACA enrollment numbers boosted their quarterly results. Their chief executive officer says that the risk pool and the product selection seem to be coming in the manner that we had hoped it would. It's very encouraging. United Healthcare, which had a pretty small footprint in these exchanges, has now changed its bias to increase the participation in exchanges in 2015 because it says it saw a positive response from consumers who enrolled in the plans that they did offer in limited states in greater than expected numbers. 15 million people, including 8 million people on private insurance plans enrolled, saving money for taxpayers, for insurance companies. That's the real story of the Affordable Care Act. And Madam President, let me just finish by sharing a couple more stories from Connecticut with you. And I'm going to share them through the eyes of the enrollers, because the enrollers and the insisters are really the heroes of these last several months. There was an embarrassing rollout of the Affordable Care Act in the fall of last year, a website that should have been working on day one that wasn't. But the fact is that thousands of people all across this country, working in community health centers and emergency rooms at nonprofits, decided to make this thing work in red states and in blue states, and went out and enrolled in record numbers, shattering expectations, people in affordable health care. And so I had a few of these assisters together in Connecticut, and they started telling me stories, and I'll finish with two of them. Michael, who is an assister in Danielson, Connecticut, told this story. He says, I recall a husband and wife who came into our health center and didn't have health insurance, mainly because they indicated that their employer's insurance plan was way too expensive. As I went along asking questions during the application, the husband mostly complained about Obamacare. He kept saying that our government is making it so no one can afford insurance, and that he and his wife heard that insurance plans were still way too high, even when going through the exchange. After completing the application and showing them the plans that were offered, they were totally surprised by the minimal cost of the premiums as well as the deductible rates. I also helped them understand how certain plans were structured and what services the deductible applied to. They left that day choosing a plan that was right for them. Needless to say, they went home from our meeting feeling more confident about their choice, more educated about health insurance, and less resentful about the Affordable Care Act. Sean, who is an assister from Norwich, tells this story. I met one middle-aged man. He hadn't had insurance for over 5 years because all the plans were so high and unaffordable that he was over the income and he was over the income for the state Medicaid insurance program. He had a few prescriptions and had to pay out of pocket around $150 to $200 every month. We successfully completed an ACA application and selected an Anthem Blue Cross Blue Shield plan with tax credits. The plan's monthly premium was only a fraction of what he would have paid every month for his prescriptions and medical care, and the prescription drug copay was only about $10. This man was ecstatic, and he said we would have to go home to figure out a way to spend all of the money that he would save every month with his new plan. There are stories like his and like Dean's all over the country. 8 million of them just when it comes to the people that have signed up for private health care. But for the rest of us that had health care, the news is good as well. $1.7 trillion off of the deficit, a program that's costing 15% less than we had expected, an overall Medicare inflation rate for taxpayers that's coming down. And for many of us, the ability to sleep a little bit better at night, because we know that the most affluent, most powerful country in the world has committed itself to the idea that somebody like Dean, a logger going out and working the land, doesn't have to die simply because he doesn't have the money to pay for surgery. In so many ways, Madam President, the Affordable Care Act is working. Now yield back.